What if 30 minutes of your time could save your life? You might be feeling nervous about your breast screening, and you are not alone. But in this video, I'm going to go through what to expect and why I don't think you need to feel so nervous. But rather than just tell you what I think, I wanted to show you what it's really like. My sister Kathryn was invited for her first ever breast screening, and she kindly agreed to let us follow her journey. And later on, I'm going to be joined by Dr. Reeden. Liz is a former breast surgeon who's also had breast cancer herself. So today I'm going to go through common concerns, walk you through what actually happens during a breast screening appointment, and explain why this simple step is so important for your health. Before we get to follow Kathryn through her screening, I'd like to give a little quick explanation as to why breast screening matters. Breast cancer is the most common cancer in women worldwide. In the UK alone, over 55,000 women are diagnosed with breast cancer each year. But here's the good news. When breast cancer is detected early, treatment is much more likely to be successful. The current evidence suggests that breast screening reduces the number of deaths from breast cancer by about 1,300 a year in the UK alone. That's enough women saved to fill over 3 full aeroplanes. And that's because screening can catch changes in breast tissue before you have even noticed anything's wrong. And for many women, this early detection means less invasive treatment and a better chance of recovery. So, while it's normal to feel nervous, breast screening is one of the most important things you can do for your health. And now let's find out what happened with my sister Kathryn. So I went along with her and filmed her getting her breast screening done. And then I caught up with her and we watched this together and chatted about step by step what happened, so you get a really good insight into what really goes on when you go for your breast screening. Okay, so I'm here with my sister Kathryn, and you turned 50 last summer, didn't you?
Yes, yeah.
And you got your invitation through the post, is that right?
Quite quickly, actually. What I was worried about was nobody really knows what happens when that door's closed, because nobody ever talks about it, or you've never really seen anything else. So I just thought, yeah, that'll be really helpful for people to actually see what happens.
Well, do you know, even as a GP and a doctor, I've never seen this before. I didn't know what happened. So it was super interesting for me.
Yeah.
And I think it'll be really
You don't
helpful.
take anybody with you, I think, to it, so you wouldn't ever know. So yeah.
Yeah. Although you can actually
I
ask
imagine,
to take someone with you if you're feeling nervous and you want someone there as a chaperone or a friend or a family
Yeah.
member. All right, let's have a look. Okay, so this is you arriving at the breast screening, and this was a mobile unit, wasn't it?
Yes. Yeah.
So it's handy because it's not too far, is it, to go?
Yeah, very local to my house, so it was easy to get to, and just straight after work.
I think some women do get appointments at their hospital where there can be a breast clinic there as well. So how are you feeling at this point?
Yeah, anxious, a little bit apprehensive, as you are when you don't know you're going into something that's unexpected. As you can see, I'm kind of clasping my hands a bit nervous. But the technician, she was, as you can see, explaining to me what was going to happen, thread to needle. She was so super lovely.
She had such a nice, calm manner about her.
She really
as well,
was. And you can tell it's a job. She does it every day.
Yeah.
She did put me at ease.
Yeah. And I guess that's the thing as well. When you think about possibly being embarrassed about having to get undressed, you know, this is all she does all day, every day. So she's seen every breast size and shape.
She's seen it all. She's not bothered.
She's not. And I think
while
that helps.
she's explaining, I've got my jacket on at that point, because I did think, do you have to go in and be naked? And then she's going to talk to me and I'm going to be stood there, uncomfortably. But no, I'd got my jacket on at that point, and she's telling me that she's taking 4 pictures. She's taking 2 of each breast, top to bottom on each side, and then at an angle as well. She did say if it gets too uncomfortable, just let me know. And so...
Yeah, she said we can stop at any time.
Yeah, she did. Yeah.
Yeah, and then it was quite a big machine, isn't it? We were in quite a little room, but it's quite a big machine.
Big machine, small room, but it's all it needs to be, isn't it?
And
but she talked me through the whole thing.
It's not too noisy or
No,
kind of
not noisy at all, no.
No. And what was it like? Was it painful?
I wouldn't say it was painful, no. I'd say I would use the word uncomfortable, but very minimally. Do you know what I mean? I've had much more discomfort for other things.
Yeah.
And it's over so quickly as well.
Yeah,
So,
I think you were in and out in
10 minutes.
10 minutes.
10 minutes,
yeah.
I think, yeah. So yeah, it was pretty quick and efficient. I mean, it's really efficient. So it's well worth doing. And
look, you can tell you don't look too unhappy.
I'm laughing. She really did put me at ease, and so I could have a giggle. She just explains what to do. She helps put you in the right position, like I say, so you're kind of leaning in a bit. But as long as you stay still, as you can see, it's super quick. It's super, like my face, like, oh, is that it?
And I think some women worry if they've got very small breasts or very large breasts. But again, they use
doesn't make a difference, I don't think. Not at all,
however
no. however it goes. Because a few of us had got the letter through from work. So we were discussing it at work, actually. And we were discussing that nobody ever really talks about it. And I was saying, oh, well, this is good that we're all talking about this now.
Yeah, because there is still not a great uptake as much as we would like. And I think a lot of the reasons are people think it takes too long and it's going to be too painful and too embarrassing. But I think
just put it off and put it off and put it off. Exactly, yeah.
Yeah, but you discovered that wasn't really the case.
No, I think as soon as you get that letter through the post, you just book it and then it's done. And then you go and do it and then it's done.
That's it. Try not to overthink it.
Don't overthink it. There's nothing to overthink, really. So that's where it goes at the angle.
Yes. That's the side one.
And you just got to kind of... She explains exactly what you need to do. Like I say, it was leaning in just a little bit. But she makes sure you're in the right position, as you can see. It's just, yeah, quick and easy, really.
All right, so that was the video.
Yeah.
So I think all in all, what's your kind of key takeaways?
I would say as soon as you get that letter through the post, don't hesitate, get it booked in, then it's booked in. You'll feel so much better I felt so much better knowing that I'd done it. I thought, right, it's done. And I would advise other people to do the same.
Yeah. And she said to you there, didn't she? She said you should expect the letter in about 2 weeks.
Yeah, she said that, but she said not to panic if it wasn't within 2 weeks, just to get in touch with them. But I think I got mine in about 10 days. All clear, all good.
Yeah.
Yeah. I would like to think that anybody who watched this video would feel much more comfortable now and happier to just go and do it and get it done.
Right, so the key message, go get it done.
Go get it done.
Thank you so much again for sharing your journey with us.
You're very welcome.
Hopefully that's really helped a lot of people understand better what to expect.
Yeah.
Okay, now let's move on to my interview with Dr. Reeden. Having been a breast surgeon who was herself diagnosed with breast cancer 3 times, she truly understands what it's like both as a doctor and a patient. I wanted to start off just by asking, as a former breast surgeon and someone who's experienced breast cancer yourself, what do you say to women who feel nervous or hesitant about going for their breast screening?
Well, I always used to say it won't hurt and you'll be fine. And then I was due to have a mammogram and I was really scared that it was going to be painful. I was 40. And I think that apprehension is real. You don't know what it's going to be like and you hear horror stories. The mammogram itself takes about 30 seconds for each breast. And we do 4 pictures in total. And if you are younger or you have quite dense breasts that are heavy, it may be sore and it's like an uncomfortable pinch. I'm not going to lie, but it doesn't last very long. It's a really clean, calm area. The women who do the mammograms want to make you feel at home. They know how you feel. And I'd say, I know there are a lot of people who think that you shouldn't go for screening and that breast cancer isn't important, but I've seen the results of mammograms and we pick up breast cancer at an earlier stage where women need less treatment. And I would say, ask questions, you can ring up the unit, look at all the leaflets, look at all the information, but just go. You don't know what it's like until you've had it.
I think that's the best advice, isn't it? And what have you come across that are the kind of the most common myths or misunderstandings about it? I guess pain is one of them.
So pain is not kind of a myth. It's like it might hurt, but generally as you go into your 50s, 60s, 70s, your breasts become less dense, so it doesn't hurt at all. The biggest myths are that mammograms cause breast cancer, so you shouldn't have them. And this is true. Your risk of getting cancer from a mammogram, it's about 1 in 10,000 women will get, if they have every mammogram from the age of 50 to 70, then an extra 1 in 10,000 women will get a breast cancer. But in your 70s, your risk of getting breast cancer is 1 in 4. So it's a very, very tiny, tiny impact, the radiation they worry about. And the radiation from a mammogram is 1/10 of a CT. And it's like living in your normal country for 6 or 8 weeks because it's background radiation all the while. So the risk of cancer from a mammogram is tiny.
Well, that's such an important point to cover, actually, isn't it? When you hear sometimes there's a lot of misinformation online, which you are always brilliant at countering. So we kind of mentioned about it, people worrying about it being painful or embarrassing, but a lot of people think it's just not worth it. Maybe if they haven't got symptoms, they don't think they need it. What do you think about that?
Exactly, or they have dense breasts. So the whole point, it's kind of comes down to mammograms are due to public screening where you are screening a healthy population, and the aim is to pick up a very small cancer before it gives you symptoms, before you can see it, before you can feel it. because we know the earlier it is caught, you are less likely to need treatments like a mastectomy and chemotherapy. You're likely to be potentially cured. That's why we screen it. It can pick up breast cancers that are 2 or 3 millimeters in size. That's the point, because a breast cancer can take 5 or 10 years to grow. So the earlier they catch it, the better it is. In some parts of the UK, only a third of women are going for their mammograms, and only half of women are going for the second or third screening mammogram. And screening only works if everybody goes.
Yeah, I mean, that's one of the reasons I'm making this video, because locally to me, we have
Yeah.
poor uptake. So I'm hoping that by watching this video and learning about this, more women are going to have the kind of courage to go forward and have the screening. And I guess some women might think, well, I missed the appointment. It's been years actually now. Maybe I'm too old, or it's too late. What do you say to those women?
So if you've missed an appointment, you can contact your local screening unit and they will fit you in. And if you've got to 70 and you are still watching, you can self-refer for a mammogram every 3 years, because the risk of breast cancer does still going up. So you can have them for the rest of your life. It is really, really important. And I would say, if we mammogram 100 women, 96 of them will have a normal mammogram, and that's it. 4 will be called back because they see something, and of those 4, 3 will be normal, 1 will be a cancer. So 99 out of 100 women will have a normal mammogram, and just having that sense of relief, I'm okay, I'll carry on checking my breasts. It's not nice having it done, but I think that sense of reassurance is really, really important.
Yeah, absolutely. I mean, I suppose in many ways it mirrors cervical screening, which younger women have done as well. It's that same, like, it's just such a short amount of slight discomfort for that kind of years of reassurance. And from your perspective, both kind of medical and personal, why is that early detection so important?
Oh, goodness. I'm going to be honest here, Sophie. I never checked my breasts. I was a breast surgeon. I thought it would never happen to me. And I came out of the shower one day and noticed a lump, and I was 40. And I wonder now, if I checked my breasts regularly, my story might be very, very different.
Wow.
We know most women don't check their breasts unless someone in EastEnders gets caught, or a celebrity. And I think mammogram is part of that early detection. I've had chemo. It's not fun. I've had a mastectomy. It's not fun. If we can pick up cancers at a much smaller size, you need less invasive surgery, in and out in the same day. You're less likely to need more aggressive treatments like chemotherapy. You are more likely to be cured. The impact on your life will be much smaller. And you see women who've left and who've waited, and they come in and suddenly the prognosis is much worse than it could have been. And it just broke my heart as a doctor. And I get the fear, and I get a lot of people think breast cancer is everywhere. I don't want to know. I'm going to bury my head in my sand. But it's really, really important to have the screening so you know. But even if you had the mammograms, you must still check your breasts in between, because cancers do appear in that 2 to 3 year period. It just makes sense to me to do everything you can to keep yourself as healthy as possible.
Yeah, that makes a lot of sense. And actually, we previously have done a video about breast lumps as well, and so we talk a bit about there. So if women want to examine themselves and feel a lump and wondering what they should be feeling for, people can check out that video as well. But that's really powerful. I think, is there any kind of one thing that you would say to women? If there's one takeaway from this interview, what do you want people to kind of take away?
You don't know what it's like until you've had one. So if you're nervous or you're scared, trust me, the radiographers doing it are wonderful, and they will look after you and hold your hand. And it won't be as bad as you think. The waiting for the results won't be fun. And that is the problem with the scan. You're waiting for that letter to come through the post. But most women won't have breast cancer. And if you do, you're not alone. It will be caught early, and the NHS will look after you.
That's brilliant. Thank you so much again, Liz. That's fantastic. I know there are lots of reasons why women might avoid breast screening, so let's just talk about some of the most common concerns and why they shouldn't really stop you from going. Some women think, I don't need it. But even if you feel well and you have no family history of breast cancer, it's important to remember that 1 in 7 UK females will be diagnosed with breast cancer in their lifetime. So breast cancer is unfortunately very common, and screening is for everyone. We've already gone over some concerns about pain and embarrassment, and it's completely normal to feel self-conscious. But the staff are trained professionals, and they do this every day. Their goal is to make sure you feel comfortable and respected. Some women, and you might have thought to yourself, I don't really have time, I'm very busy. But the actual mammogram, like Kathryn said, just takes 10 minutes, and the whole appointment is usually about 30 minutes. That's less time than it takes just to have a cup of coffee with a friend or to scroll on social media. So when you think about the potential benefits of early detection, it's a really small investment of time for something that could absolutely save your life. So remember, it's normal to feel nervous, but you're doing something really important for your health. And please do share this video with the women in your life, because early detection saves lives. Your health is worth it. Take the step. Get screened. Thank you for watching. Do check out my other videos on my YouTube channel. I'm Dr. Sophie GP. Take care.